It is now our honor to be joined live from Gangtok by Shri GT Dhungel, the Minister for Health and Family Welfare for Sikkim. Sikkim has been a leader in HPV vaccination in India since August 2018. 6 years ago, it became the first state to roll out an HPV vaccination campaign for girls between the ages of 9 to 14 years. With 6 years of experience and learning, this is an opportunity to speak with Shri Dhungel about the challenges and the learnings that Sikkim has had with this vaccination rollout. Thank you so much, sir, for joining us in this
Madam,
very,
thank
very
you.
special campaign. First and foremost, congratulations, sir, on Sikkim becoming the first state to implement the HPV vaccine at the state level. You began back in 2018, and your HPV vaccination campaign was incorporated into the state's routine immunization program. We really want to know from you what led to this, what were the conversations and the thought behind this?
Good afternoon, madam. It was nice to be with you, and it's a privilege to be amidst all the learned people here. For information, our government, which started under the able leadership of our Honorable Chief Minister Prem Singh Tamam, he is very proactive and he is very compassionate towards all the people here, and he wants to see that the health is well maintained, ranging right from the childhood up to the old age also. Just recently also, we have rolled out a scheme under the guidance of the Chief Minister. And of course, it's a central scheme, but it's for the aged also. But the HPV vaccines, which we had carried out in 2018, it has helped a lot because the cervical cancer was quite common here in Sikkim. So this launching of this HPV vaccines has protected a lot of girls from having this cervical cancer because under the CASH program also, we did the screening for the cervical cancers. So when we had this opportunity to roll out the HPV vaccines, that has helped a lot and it has controlled the spread of cervical cancers to a great extent. And for that, we are really grateful to the government of India and the leaders there in the center, and not forgetting our very dear Honorable Chief Minister, who has been very compassionate and he is very proactive regarding the health matters.
Right, sir. Well, what has the experience been these 6 years? If you could share that with us, what were the challenges? Did you have to work on awareness in the community? You said there were many cases of cervical cancer there. Clearly, that's why you found the need. If you could talk to us about the challenges and what sort of awareness you had to carry out.
Yes, like reaching out to the people in the remote areas is difficult because ours is, like some terrains are very inhospitable, especially during monsoon when the roads are cut off, and the communication is not there. At that time, it's difficult. So we engage all the health workers and we create awareness by carrying out rallies and through other activities also. And we engage the NGOs and all the local leaders also engaged in that. And we take help of the media, also social media, and we try to reach them out. Of course, there are a lot of fallacies and people have misconceptions regarding this also. So sometimes we take use of the faith healers also. And then apart from that, we reach out to them in many ways, in whatever possible, so that we get maximum benefit out of these HPV vaccines. And constraints and difficulties are of course there because you know how Sikkim is. It's in rural areas which are inaccessible. There we have to send people, health workers, and other people also, and even we have to create awareness amongst the local leaders also, and that's how we started getting good response from the people, even in the villages, and even the people those who had all the misconceptions regarding that. We cleared all that, and gradually now we are trying to reach out, and we have reached out to them also. And the experience what we have gathered, it's really good, and HPV has helped a lot. HPV vaccines, so that now the cervical cancer has come to a great control. So the spread also, if you see around what it was before 2018, and now after the vaccinations have been carried out successfully, the rates have been controlled to a great extent, and that's why the people of Sikkim and we in general are very happy.
That's amazing. I mean, just in 6 years, they've managed to bring down the prevalence of cervical cancer. I think that calls for a big round of applause. Absolutely incredible, and so heartening that despite the odds and challenges, that clearly the government's worked very hard at this. You spoke about involving a lot of local leaders, about faith healers as well. If you could tell us more about that. How did you overcome the resistance from the community? Tradition, mindset, taboos around this cancer and the vaccine?
And actually, see, like when people suffer, the first and foremost what people require is good health. And for good health, now when faith healers go around spreading all sorts of rumors, and then they have their all sorts of misconceptions that when they try all the tricks and then when it doesn't work out, then ultimately they'll have to resort to these medical facilities and the vaccines which we had rolled out. So all these things combined together uh, have helped overcome the misconceptions which the faith healers had, and even the local leaders and the community leaders who were a bit doubtful about the vaccine after the results, which has been explicitly revealed and they can now see around, has convinced them, and all these factors where they could see the reality and the process and the effects of the HPV vaccines, people have now considered that this is good and they should go in for that. So now it has been used and it is being used explicitly in a wide way in regard to the vaccines relating to HPV.
All right, wonderful. Dhungalji, now we do know vaccines are usually part of the national immunization program. We're still
Yes.
awaiting that the government will do something more on this. And that's also because of the costs that are involved in a vaccination program. So tell us, how does Sikkim sustain, support, and fund the vaccination program for all the eligible girls?
No, actually, it's mainly the center, the government of India, who have been very kind to us, and whatever fund we have with the state, with that we try to procure the vaccines, and we try to use that for all the girls, especially ranging between 9 to 14 years, and that we have been doing very successfully. Of course, there are constraints in regard to funding, but then the government of India has been very kind, and they have been helping us from time to time. So there's not much of issue on that.
All right, wonderful to hear that, and hopefully other states will also overcome, this reluctance or be more enthused to have it as a part of their program. But if you could share with us, sir, what have been your most significant collaborations in the implementation of this vaccination program?
Collaboration in the sense that we have collaborated with all the important people like the community and the NGOs, the local NGOs are there, the community groups are there, healthcare providers are there, and then the stakeholders are there. These participants are instrumental in ensuring the success of the HPV vaccine campaign.
All right, and as I mentioned earlier, there are other states that are considering this. They're struggling to initiate the HPV vaccination program. You could tell us about how Sikkim has managed to stay ahead, and what would you say to them, other states that may be considering this?
No, for anything to succeed or any plan to take over or any campaign you want to take over, you need people's involvement. The people involvement with all the stakeholders should be there. The government representatives have to be there. The NGOs will have to be there. So for this, everyone has to come in and play the vital role. And for this, the backup and the encouragement is very much required from the government. And especially for Sikkim, if you see at this juncture, the Honorable Chief Minister P.S. Tamang is very active, as I said. He is very compassionate and he is very proactive in regard to health, and he's given health sector number one priority to ensure that as long as people are healthy, they can go ahead and they can do whatever they feel like. But if the health is not there, then they can be nowhere. So in regard to all this, if you see, the government has been very kind, and then above all these things, the people need to be committed, and they need to come together and to see that the schemes whatsoever the government of India has come forward with, we need to implement it in both letter and spirit.
Right, sir, and you've already seen what an improvement in women's health ever since you began this vaccine program. And vaccination is one way of fighting cervical cancer. Then, of course, there's screening. If you could tell us what are you doing in Sikkim to increase awareness around screening for women, and so that the rates will increase and potential cancers can be caught.
No, we have the mobile vans are there. Then we have health workers who are spread all over the places, even in rural areas. So they go on having doing the screening and other necessary tests, whatever is necessary, so that the cervical cancer, if they are there possessed by cervical cancer or they are affected by cervical, can be detected at early age. So when it's detected at early age, the prevention and the cure is very much there. So that's how we have been doing. And I would like to thank the health workers who have been very sincere, committed, and dedicated. And they have been putting all their efforts to see that they reach out to the people wherever necessary.
And finally, Dhungalji, if you could tell us what are the biggest learnings that you've had, and what would you say to if we wanted a national level program, what could be applied to such a program from what your experience has been in Sikkim with this vaccination program?
What I feel now from our learning, we see that people have to be proactive, they have to come forward. They should not just confine themselves to their villages or homes, because whatever the government does in regard to health, it's for their well-being. So it's my plea and my suggestion and my request to all the people all over India that they should come out, cooperate with the government, cooperate with the health workers. So whatever information they have, they should not hide, because if they hide later on, it may become a major problem, and at that time it will be too late. So a check-in time saves 9, they say, no? So a stitch-in time saves 9. So that adage has to be adopted. So whatever has to be done, it should be done early, and the treatment, if done early, can confine or cure the disease whatsoever.
Well, thank you so much, Shri Dhungalji, for joining us on the program. And I think it's absolutely incredible to hear from the minister about how this has changed, women's healthcare there in Sikkim. Thank you so much for joining us on the program and sharing that experience. And hopefully, we'll see more states and a central program as well inspired by Sikkim's experience.